part of what has been evolving over recent years in response to all of those ongoing shortages has been this constant messaging from other professions of, oh, you rural GPs are too busy to do this work here, let us take that on for you. And we're hearing more and more from our members that this incessant scope of practice creep, which is coming from other professions, is really starting to undermine the role of the general practitioner. Anita, how would you defend that critical central place of the rural general practitioner against the scope creep from other professions?
The hard facts of the matter is that no other craft group can replace the expert skills and knowledge of a generalist, an expert generalist who has been trained for more than 10 years in the art and science of general practice. And I do reflect also that with some of the projects that have occurred in terms of increasing scope of practice, particularly with pharmacists, the majority of those services have been delivered in metropolitan areas. So they are not solving any kind of rural issue with those changes to scope of practice. Having said that, however, we do recognise that multidisciplinary teams are necessarily the way of the future. But the most important point there is that there's only really one person who has the skill and knowledge and experience to take on the responsibility of the clinical governance of an MDT, and that is an expert generalist. Nobody who has lesser training or training in only one body system or one component of delivering health will have the requisite skills. So multidisciplinary teams must be led by GPs, particularly if we are to preserve quality and safety. And I do not agree with access at all costs if that cost is a lowering of quality and safety and then the resulting patient harms that we have seen that have occurred in other pilots around the world. So the hard facts are that you need to be an expert generalist in order to oversee and take on the responsibility of an MDT. But I do believe if we set up those MDTs appropriately, we will better serve communities, particularly rural communities.
Well and truly, well and truly.